We're focusing on a critical skill for your phlebotomy technician certification exam, the capillary puncture fingerstick procedure. The exam will absolutely test your knowledge of proper site selection. You must use the fleshy lateral portions of the distal phalanx, which is the fingertip, on the patient's non-dominant hand. The preferred fingers are the third or middle finger and the fourth or ring finger. A common exam question will present a scenario where a phlebotomist chooses the index finger or the pinky, and you'll need to identify this as an error. The index finger is often more calloused and sensitive, while the pinky finger has insufficient tissue depth, increasing the risk of striking the bone. Puncturing the bone can lead to a serious infection called osteomyelitis, a term you must know for the exam. The thumb is also incorrect because it has a pulse and is often calloused. The lancet depth is another key area. For an adult, the puncture should not exceed 2.0 to 2.4 millimeters. Exam questions might test this by asking you to select the appropriate lancet size for an adult patient to prevent bone injury. Always remember to puncture perpendicular to the fingerprint lines, not parallel to them. This technique helps form a well-rounded drop of blood instead of having it run down the finger, which would make collection difficult. After the puncture, the single most important next step, and a frequent exam trap, is to wipe away the first drop of blood. That first drop is contaminated with interstitial fluid, also known as tissue fluid, and potentially residual alcohol from cleaning the site. This contamination can dilute the specimen and lead to inaccurate test results, particularly for tests like hemoglobin, potassium, or glucose. Expect a question that asks for the rationale behind wiping away the first drop. The answer will relate to preventing contamination and ensuring specimen integrity. The final critical concept is the collection itself. You must allow the blood to flow freely and collect the drops without excessively squeezing or milking the finger. Exam questions love to test the consequences of milking. Vigorous squeezing introduces excess tissue fluid and causes hemolysis, which is the rupture of red blood cells. Hemolysis will falsely elevate potassium and other analytes in the sample, compromising the test results. To help you remember the correct fingerstick procedure, use the mnemonic MRWGS. That's MR for middle or ring finger, W for wipe the first drop, and GS for gentle squeeze. This simple phrase covers the most tested aspects of site selection and collection technique, ensuring you avoid the common traps on your phlebotomy exam. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.